Well, there's some pretty strong feelings going on with the NHS because we've got data coming out about ambulance delays that have increased hugely in recent weeks. There's now to wait 30 minutes or more when you arrive at the hospital before you are disembarked into the hospital itself. 1 in 3 patients. Just imagine that. 1 in 3 are waiting over half an hour from when you've arrived at A&E. Doesn't sound like much of a service. That, on top of the fact that from the 20th to the 23rd of December, and then again in the new year, something to look forward to, from the 3rd to the 9th of January, we're back to the strikes. Yes, the BMA junior doctors are striking again. This is not encouraging news. I'm delighted to be joined on the line by Dr. Paul Scott, who's a GP and is chair for the Northern Staffordshire Trust. Dr. Scott, thank you so much for joining me. Not great news. I guess it's always challenging for the NHS in the winter. We know that every winter is a difficult time, but some of this data is pretty shocking. A third of patients arriving at hospital, waiting half an hour in the ambulance before handing over. What's going on there, Doctor?
I think the issue is that the government, the media, the public always seem to look at this from the point of view of what's visible and where, if you like, the symptoms of the problems in the NHS. And the most visible one is A&E and ambulances queuing outside and people having to wait. As a 30-year experienced GP, that actually isn't the problem. The problem, when you look at it, is actually everywhere else. And to start with, general practice, we're 2,200 GPs down compared to 2015. We've had a huge recruitment of less skilled staff who often have to see patients more often before patients eventually get a diagnosis. And in general practice, in spite of us operating at a 15% increase than before COVID, we're just still not getting through the demand. We've also got a 111 system that's really quite risk averse and piles people into hospital as well. A&E itself and the whole hospital sector is operating slower than it did before COVID, operating only at 70 to 80%. Some of this is just the sheer catch-up of the increasingly ill people, but it's
a relentless increase in demand, it sounds like. There is some good news, though, within the data that I've just read, which is that in the last month's waiting list data for operations and treatments actually has basically held flat at about 7.7, 7.8 million. I suppose we should be grateful for small mercies, particularly at this time of the year.
So what your listeners will be interested in what I think what are the answers? The answers, and I really hope this sinks in, because the answer isn't just to try and pour money, put a bandage on A&E or get a few more ambulances. The answer is in general practice to allow the money spent on non-doctors to be spent on doctors. There are GPs qualifying now who are actually unemployed because there are no jobs for them. And that just needs a relaxation of the rules. We need better medical filters on 111, so only the people who really need to go to hospital. And we need definitely A&E led by the most experienced doctors. The other bit are nursing homes, the care sector. We need investment there and much better
I think most people, Doctor, recognise that actually it's not more money, it's reform of the processes that you quite rightly being touching on. Let's move on to the forthcoming doctors' strikes, the junior doctors' strikes before Christmas and just after the New Year. I mean, this really is the worst possible time for them to go on strike, regardless of the merits of the case or otherwise. It does seem that they're not exactly going to win any friends or sympathy from the general population.
I think their morale, how they're treated by the NHS, how this country treats junior doctors, they're almost at a level where they're beyond caring. They were offered just 3%. They've lost 25, 30% compared to a few years ago in relative income. But money isn't everything. It's how the NHS treats them. They're on inflexible rotas. There are gaps, many gaps in their rotas where they're cross-covering.
So are you really saying that actually they don't care? I mean, if they feel they've got a case, that's one thing. But to go on strike at this time to create maximum damage, maximum angst, at literally the worst time of the year, when lots of other health staff are on holiday, for example, I actually think it's shocking, bordering on selfish.
I understand that, but I think they're thinking in the medium term. So we're getting an NHS that's wrecking its retention of junior doctors. And junior doctors are leaving in droves, many of them going less than full time, many of them exploring other countries, as you're aware. The continuation in training rate 2 years after qualification is about 40%. This is absolutely appalling for a country like ourselves.
That is for sure. That retention rate sounds woeful. I just think the timing of this is going to lose a lot of sympathy for the merits of their case.